Welcome, everybody. My name is Doug Sesserman, and I'm privileged to serve as the Chief Executive Officer of American Associates Ben-Gurion University of the Negev. It's hashtag Webinar Wednesdays, and we're live from Israel. It's noon Eastern Time, 7 p.m. in Israel, and today we have an incredible set of panelists who are leading experts in Israel, both in terms of autism research and treatment. And what makes today even more special is the collaboration between American Associates Ben-Gurion University of the Negev and the American Friends of Soroka Medical Center. I'm pleased to introduce Rachel Heisler, who's the Executive Director, to say a few words before we start. Rachel.
Thank you, Doug, and welcome to all. I am delighted for today's opportunity to collaborate with American Associates of Ben-Gurion University on such an important topic as autism. Soroka Medical Center and Ben-Gurion University are the core pillars of the life-saving innovation that emanates from the Negev, and there's a great deal of synergy between these two institutions that benefits the residents of the Negev, Israel, and indeed the world. Soroka's campus is directly across the street from BGU, and we are the teaching hospital for the two outstanding BGU medical schools. Soroka is the sole medical center for the entire south of Israel and is responsible for the health of 1.2 million individuals. Given our close proximity to Gaza and the recent relocation of major IDF bases and intelligence operations to the Negev, we play a hugely strategic role in providing trauma care in times of conflict. During the COVID-19 pandemic, Soroka has emerged as a true global leader and role model, implementing safety protocols, building an isolated emergency hospital, and establishing a comprehensive testing program for our communities. One of the newest centers of excellence is the Legacy Heritage Oncology Center, bringing state-of-the-art cancer care to the Negev. This comprehensive cancer center is a stellar example of the synergies I mentioned. It is home to the Dr. Larry Norton Institute. This world-renowned oncologist selected Soroka as the home for novel research that will leverage Ben-Gurion University's mathematics department and the high-tech prowess of the Gaviam Technology Park, and utilize the data gathered and stored at the Negev Biobank in the Soroka Ben-Gurion Clinical Research Center, all to crack the code of cancer. While caring for an intensely diverse population, several of our unique departments truly touch the heart. Soroka's neonatal intensive care unit is an international leader in the care for the tiniest and most fragile newborns. Over 50 babies are born at Soroka daily, one half of which are Jewish. The rest are predominantly Bedouin, Arab, and refugees. In our NICU, we save the lives of these newborns and partner with the families in improving healthcare outcomes for the babies. With your continued support, Soroka is able to reach new heights, and we still have a lot of work to do to support a healthier society in Israel. We thank you for your generosity and your meaningful partnerships. And now we proceed with today's imperative topic, autism. Given our intense focus on medical innovation, research, and caring for underserved and fragile populations with extraordinary compassion, we are proud of our work with the autism experts in the Negev and look forward to learning from them today. Thank you all for all you do every day, and back to you, Doug.
Thank you, Rachel. And we really appreciate the collaboration and partnership with American Friends of Soroka Medical Center. Today we have a great set of panelists, so my job is just to introduce the panelists, and then we'll let this webinar take place. For those of you who've joined us before, thank you again for participating. For those of you who are new to our webinar series, today we're going to have a presentation from 4 experts. They're actually going to use a PowerPoint presentation to have their discussion. If you have a question, you just click on the Q&A function and write your question. After the presentation, which will last about 40 minutes, we'll then use the tail end of the program to answer people's questions. So joining us today are Professor Ilan Dinstein, Professor Hava Galan, Dr. Gal Ma'iri, and Dr. Edan Menashe. So we're going to start with Professor Ilan Dinstein, who is BGU's Department of Psychology and Cognitive Brain Sciences, and also the director of the National Autism Research Center in Israel. His specific subtopics include the use of eye tracking, neuroimaging, and other technologies for the early identification of autism. Professor Dinstein joined BGU's Department of Psychology and Cognitive Brain Sciences in 2012. His research focuses on the neurobiology of autism with particular emphasis on early development. He is the founder and director of Israel's National Autism Research Center, which collects vital information from children with autism and their families to improve autism diagnosis and treatment. Housed at Ben-Gurion University, the center brings together researchers and clinicians from a variety of universities and medical centers in Israel and is funded in part by the Israeli Ministry of Science. Professor Dinstein is the recipient of the Alon Fellowship from the Israel Council of Higher Education and the Soretsky Prize for Advances in Neuroscience. He earned his bachelor's degree in biology from Tel Aviv University and his PhD in neuroscience from New York University. Professor Dinstein did his postdoctoral work at Carnegie Mellon in Pittsburgh. He is going to lead our discussion after Professor Dinstein presents. I think it'll be easier if I just introduce all the panelists now. Following Professor Dinstein, we'll have Dr. Ilan Menashe from the BGU School of Public Health. His subtopic includes understanding genetic and environmental risk factors in autism. Dr. Ilan Menashe is a faculty member in BGU School of Public Health and a member of the steering committee of the National Autism Research Center in Israel. He is also the scientific director of the center. He earned his undergraduate degree in the Faculty of Health Sciences at BGU. He received his PhD in human genetics and bioinformatics from the Weizmann Institute of Science and completed his postdoctoral training in genetic epidemiology and biostatistics at the Biostatistics branch of the Division of Cancer Epidemiology and Genetics of the National Cancer Institute in the States in Maryland. Dr. Menashe also served as the senior scientist at MindSpec, a bioinformatics company located in Virginia before his return to Israel. At BGU, Dr. Menashe leads a unique interdisciplinary group that focuses on 4 research areas related to autism: identifying genetic and non-genetic risk factors, early biological and physiological markers for autism, studying health disparities in autism diagnosis and treatment, and identifying unique characteristics associated with different autism subtypes. Our third speaker will be Professor Hava Golan of BGU's Department of Physiology and Cell Biology. She'll speak about the underlying specific causes of autism and how to treat them using animal models. Very interesting. Professor Hava Golan is a member of the steering committee of the National Autism Research Center and director of the preclinical studies at the center. She is also a member of BGU's Department of Physiology and Cell Biology and the Zlotowski Center for Neuroscience. Professor Golan graduated from BGU, having received her master's and PhD in neurophysiology from Ben-Gurion University. She completed her postdoctoral training at the Center for Neurobiology and Behavior at Columbia University in New York. As part of a group led by the Nobel laureate Dr. Eric Kandel, Professor Golan aims to demonstrate the benefits of personalized interventions by studying the interaction between nutrition and genes for subgroups of children with autism spectrum disorder. And finally, Dr. Gal Meiri is from the BGU Faculty of Health Sciences and is also the head of the preschool psychiatric unit at Soroka University Medical Center. He will address clinical assessments and the treatment of autism. Dr. Gal Meiri is a child psychiatrist and the head of the preschool psychiatric unit at Soroka. He is also a faculty member at BGU's Faculty of Health Sciences. He and his clinical team diagnose and treat the emotional difficulties, behavioral problems, and psychiatric disorders in infants and toddlers up to 6 years old. Dr. Meiri is a member of the steering committee of the National Autism Research Center of Israel, where he also serves as the medical director. His work includes improving awareness of autism within the Bedouin community, where autism is dramatically underdiagnosed. Dr. Meiri also focuses on diagnosis and treatment techniques that consider cultural differences and sensitivities. His work includes exploring the possibility of alleviating some of the symptoms of children with autism and new treatments in addition to and including medical cannabis. Dr. Ma'eri earned his MD from Ben-Gurion University of the Negev and did part of his residency and research fellowship at Oregon Health Sciences in Portland. He recently served as the president of the Israeli Association of Infant Mental Health and as an active member of the National Committee of Experts on Autism in the Israeli Ministry of Health. Wow. There's going to be a pop quiz, by the way, on all of your bios at the end of this webinar. So we have a very impressive group, and the last thing our audience wants to hear more from is from me. So let's start. Alon, take it from here. Thank you.
Great, thanks so much, Doug and Rachel, for hosting us, and thank you all for joining us today. It's a real big pleasure and honor to tell you a bit about the National Autism Center that we've created. I'm going to share my screen and show you a little presentation that we put together that will help us describe what we're up to. So this National Autism Center is a true collaboration between clinicians and scientists. And this is one point where Ben-Gurion and Soroka Medical Center have a big advantage. We're the only place in Israel where there's a university right across the street from a major hospital. And this is a huge advantage for us because we as scientists really want to work with a clinical population, and having the clinical population close is a big plus. The kind of questions that we deal with on a daily basis that we constantly ask ourselves is, how can we improve the diagnosis and treatment of autism? And we try to be as practical as possible in thinking about questions that we might be able to answer within a 5 to 10 year time frame. And so we often discuss questions about early identification, early diagnosis. There are lots of thoughts and initial work about how genetics and different biological markers and different types of technology might help us identify autism in a more accurate manner at early ages. We ask a lot of questions about behavioral interventions. Most of the treatments that are available today in Israel and also everywhere else in the world usually revolve around interventions that are handled in education systems or in specialized education kindergartens, places like that. There are different techniques, different types of interventions, and there are a lot of open questions about what works better and what doesn't work as well. Lots of questions about how technology might be able to assist in these domains. And after we talk about behavioral intervention, the next obvious step is medical treatments. Lots of thoughts about how using different medications and different treatments like stem cells. And you heard about the interest in medicinal cannabis a moment ago, hyperbaric chambers, all sorts of ideas and very little research to substantiate whether they actually work or not. And in addition to that, there are lots of questions about autism in transitioning into adulthood. How can we improve the quality of life, the independence, the employment abilities, things like that. And when we ask all of these questions, a critical issue is what works best for whom. And one of the big changes that's occurred in the autism field in the last decade or two is this very clear understanding that autism is extremely heterogeneous and is very unlikely. It's probably not a single disorder. It's probably a family of different disorders where different individuals have different symptoms. And what you see in this slide here is in the middle are the core symptoms of autism. This is how autism is defined by the book, by the DSM, which is the Psychiatry Bible. The two main symptoms are difficulties in social communication and the appearance of restricted and repetitive behaviors. And these symptoms come in many different flavors. They include things like not making good enough eye contact and not initiating play, and not imitating others. So children with autism often do not learn by imitation. They stay by themselves and do their own thing. And there's this lack of social motivation, but it comes in many different flavors, many different types of symptoms. Not only are the core symptoms heterogeneous, there's also a wide variety of secondary symptoms that involves things, that include things like sleep problems, anxiety, self-injurious behaviors, tantrums, digestive problems, different language abilities. So children with autism differ one from the other in very dramatic ways. And this is a huge problem, because if this is the case, how can we ever expect to find a single treatment or a single diagnosis that will work for everyone? And this is the very important motivation for creating a national autism center. So in order to make headway on any of these questions, it's imperative to do research on very large populations, and to do this research in a longitudinal manner where we follow up the children and measure them multiple times throughout their lives, also into adolescence and adulthood, because the symptoms, they change over time. Some of the children improve, others deteriorate. How can we understand what works for whom if we don't look at the long-term consequences? Not only do we need to do that, we also need to combine multiple clinical and scientific expertise. And, you know, I couldn't emphasize this more. This is one of the most important aspects for successful autism research, is the ability to bring together geneticists with psychologists, with computer scientists, with you know, a multitude of expertise, because there is no way that we're going to figure out this complexity with knowledge in just a single field. And that's what led us over 5 years ago to create what we initially called the Negev Autism Center. This is, it started out with a collaboration of several scientists at the university. You see most of us here today, Chava and Idan and Gal, who you'll meet in a moment, together with clinicians, physicians, and other experts in different fields. And so what I want to do now, we have this really nice animated movie that we've created that gives you a tightly packaged story of how we actually do our work. Oh, and before I show you that, I wanted to mention the most important thing is that 2 years ago, the Ministry of Science selected us out of many other options to become the National Autism Center. And so we've turned this Negev Autism Center into a national center with sites throughout Israel, with this really strong focus on diagnosis and treatment. And now we'll move to this animated movie that will show you the details of how we actually do the work.
In 2018, the Israeli Ministry of Science and Technology announced a grant to create a national autism research center. The grant was awarded to scientists from Ben-Gurion University and physicians from Soroka Medical Center, who had developed a unique model that integrated scientific research into the clinics where autism is diagnosed and treated. Every year, 1,800 new children are diagnosed with autism in Israel in 40 medical centers. Approximately 180 of these diagnoses take place in Soroka Medical Center. The diagnosis of autism requires multiple visits, in which clinicians interview the parents and directly assess the behavior of the child. By integrating the research into the diagnosis visits and later follow-up visits, scientists at BGU are able to collect a wide variety of data from a large number of children. This data includes detailed information about the child and family from the Soroka electronic patient record system, behavioral information from voice and video recordings of the child during interactions with the clinical staff, parental questionnaires about sensory sensitivities and sleep habits, saliva samples for genetic testing, blood samples for metabolic testing, eye tracking while watching TV, and even EEG recordings recordings during sleep. As of May 2020, the national database contained information from over 1,000 children with autism and their family members. This research is unique and extremely rare on a global scale because it combines a wide variety of data from each of the children that is captured at the earliest stages of their development, when autism symptoms are first emerging. Today, scientists around the world agree that autism is not one disorder, but rather a family of distinct disorders that are likely to have different causes. By combining multiple types of data, the interdisciplinary team at the Negev Autism Center hopes to identify these distinct subgroups of children and match each subgroup with the most efficacious targeted treatments. The National Center is expanding these activities to additional medical centers throughout Israel. This expansion enables researchers across the country to identify the most effective diagnosis and treatment methods for autism, to develop new diagnosis technologies and medical interventions, and provide reliable and scientifically based advice to government officials. In parallel, the center is building a national research community that includes physicians, scientists, therapists, parents, and adults with autism. Hundreds of community members come to the annual Israeli meeting for autism research that is held at BGU. These efforts are transforming Israel into an international leader in clinical research that is focused on improving the quality of life for individuals with autism and their families.
Okay. So I hope that was informative in giving you a bird's eye view of the work that we do on a daily basis. The really important pillar of this work is this National Autism Database. That is the source of information that is used not only by the four of us, but also by dozens of other researchers throughout the country who we're collaborating with. And this is truly a national effort. This is no longer just a BGU and Soroka effort. It has grown much larger than that. So I'm going to cut a few things a bit shorter. I want to give you a glimpse at the data that we have right now in the database. We just reached the 1,000 marker a couple of months ago. And these are children who have gone through our combined system where we have the research integrated into the clinic, and we collect a wide variety of different types of data. You saw them in the movie. You can see we, of course, don't have all the data on all of the children. This is very characteristic of building a large database like this. But we have large amounts of data on hundreds of children. And this makes it very interesting because we can now start combining these different types of data and associating them and figuring out what kind of symptoms are associated with one another in different domains, like sensory symptoms and cognitive capabilities and MRI scans and genetics and many other types of data. I want to give you a very practical example of why this research is so important. So what you see here is one of our major goals was to figure out what happens to children with autism over time. How do they change in a longitudinal manner? And so we're now at a point where we've followed up somewhere around 250 kids who have undergone assessments repeatedly. And we have the ability to measure how their autism severity changes over time. What you see here in this ADOS scale is a measure of how severe the child's autistic symptoms are. Each point here is a different child. And you see them here at diagnosis when they first visited us, and then again a year or two later. If the children who come back and receive the same score twice fall on this black line, children who fall above the line are deteriorating, their symptoms are getting worse, and children who are falling below the line are improving. So you see one first optimistic finding here is that most kids are improving, which is great. And now the big question is why? Who are those kids who are improving in their symptoms, and how can we get more children to improve more, right? And so this is one of the major questions that we're dealing with at the center. And I can show you an initial result that that's already very clear, is that the age of diagnosis is critical for better outcome. What you see here are those the same kids, again with the ADA scores, or only now we're using a comparison score, which is a bit more accurate. And you see that the kids who were diagnosed before the age of 2.5 are improving much more dramatically, and many more of them are improving in comparison to children who were identified after the age of 2.5. And so this is already clear evidence, the first time that anyone has looked at this in Israel, to show the importance of creating clinical systems that can identify autism at these very early ages. I don't have much time to get into this. I want to pass on the baton to Idan. I'll just show you a very brief example of technology and MRI scans. We use a lot of technology at the center. This is an example of my daughter in our behavioral room where we're tracking her movements. You can see that today with computer vision, we can identify different body parts and how they're moving around in space. We can identify the direction of gaze of the child. We can tell where they're looking at, when they're looking at. All of this information is very important when we think about autism symptoms, because the behavioral symptoms of autism are evident in these video recordings. There's also audio recordings. We also record the speech. A lot of autistic symptoms are evident in strange intonation and different, and also speech delays that we can record. We do a lot of work with eye movement and facial expressions that we can also identify with automated techniques. So this is one really important angle of the research. The other one is MRI scans. About a quarter of the children in the Israeli clinical system undergo brain MRI scans, and we use all of that for additional research that I can tell you more about later. And now I'll pass the presentation on to Idan. Please, Idan.
Thank you, Ilan, and hello, everyone. It's my pleasure to participate in this webinar. As you can see from this slide, my research focuses on genetics and environmental risk factors of autism. And in the next 5 minutes, I'll try to give you a quick overview of the studies that we are doing in my lab. Next, please. So we all know that genetics plays an important role in autism development. However, it is extremely difficult to identify these genetic factors, mainly because each individual is carrying a different genetic cause. Next. So for that reason, we joined forces with the Autism Sequencing Consortium, which is the largest international initiative for autism genetic research. And this initiative combines data from tens of thousands of individuals around the world and analyze them. And this comprehensive analysis just recently allows us to identify more than 100 novel genes for autism. Next. So in my lab, we actually focus on the genetic samples from the Israeli population. And we already collected more than 200 samples from Israeli families. And we also developed a unique bioinformatic pipelines that allows us to detect likely pathogenic genetic variations in non-autism genes that are presented only in the child and not in his parents. Using this pipeline, we identified already genetic variation likely causing autism in 20% of these families. Next. So here are 2 examples for these findings. On the left, you see a disruptive mutation that actually stopped the translation of one of the most imminent autism genes called CHD8. And you can see that this is a de novo mutation. It is introduced in the DNA of the child and is not presented in his parents. On the right panel, you see another mutation. This mutation actually changed the function of another important gene called SYNGAP1. And this is extremely interesting because we identified this mutation in 2 affected siblings in the same family. This is actually becoming more interesting because we recently diagnosed a third child in this family, and we are expecting to see the same mutation in this child. Next. So I'm also interested in environmental risk factors, and for this research, we are actually focusing on the pregnancy and birth periods, which are, we know, critical periods for brain development and autism. We take advantage for the fact that more than 90% of the children in our center were born in Soroka, so we have access to their complete medical records. When we look on, so this is actually allows us to compare their birth and pregnancy records to birth and pregnancy records of other children who were born in Soroka. And when we did that, next, one of the findings is that we found that children with autism are more likely to be delivered with cesarean section. And this suggests that cesarean section is associated with an increased risk of autism. We further analyzed this, try to understand better this kind of association, and we looked into the data deeper next. And what we saw is that cesarean section is not always associated with autism. Only cesarean sections that are performed with general anesthesia are increasing the risk for autism. And this is next. And this is irrespective for the type of the surgery. We see this association both in urgent surgeries and elective surgery, the same kind of association. And these findings suggest that exposure to general anesthesia during cesarean section is associated with an increased risk with autism. Next. Another thing that we are looking at is data from prenatal ultrasound screening that is very common in Israel. Again, we compare these data between children later diagnosed with autism, their sibling, and other children who were born in Soroka. And we find very interesting results. First of all, I must say that this kind of study is very unique. Previously, there were only 5 different studies that look on this type of data, and they used very small sample size, 20, 30 children. We are looking on data from hundreds of different children. And one of the findings is that we find that children who later diagnosed with autism have higher rates of fetal anatomical abnormalities, mainly in the cardiovascular and urinary systems. But we also found out that children with autism have abnormal head growth during the 2nd trimester of pregnancy. So this means that these children, something is going on with these children's brain very early in pregnancy. So we ask ourselves what we can do with all these findings. So one thing we do is these findings helps us to understand better the different causes and different etiologies of autism. But what we can do with this finding is get them to the lab, try them in animal models, and these experiments will help us to understand better the biology underlying these findings. And the person who will do that, these kind of experiments, is Professor Chava Golan. So it's my pleasure to introduce her, and please, Chava.
Thank you. I'm very excited to share a little bit of the preclinical studies with you. So the wide range of behaviors in children in the spectrum, as said by Idan and Ilan, is actually representing different biologies. So in the preclinical studies, we utilize animal models where we can take advantage of genetic engineering to express a modified single gene that was modified, either shut it down or overexpress it, or expose the animals to some environmental risk factors, as Dan just showed you, and look at the signaling pathway, the level of single neurons, the neuronal circuit, and how it's impact the behavior, and utilize this information for developing both intervention, which will be really dedicated or like targeted to the biology that was changed by this single gene shutdown, And of course, another very large need that we have are biomarkers. So the animal models actually allow us to ask these questions and bring some suggestions that should be translated later on for humans. So the animals, the rodents mainly that are used in these studies are actually rich in the repertoire of behavior. They have different social interaction that if Ilan will just press on the button of the video, we'll see that they can chase each other, sniff each other, bite each other. They vocalize during these encounters, social encounters, and we see at the bottom an example of sonograms during this vocal interaction. So each of these small lines is a syllable, and we can take them also, so we videotape them, we record them, or we can take them also into a different setting that is more structured, where we give them a choice to, here also we can visualize it, let them sniff the mouse that is restricted in a small cage, but then we can see who is initiating this interaction. Or it can go to be alone in the middle or go to explore the other side. So videotaping and offline analyzing these videos, giving us some information about hyperactivity, anxiety, but also sociability, whether the mouse is social or unsocial, if you prefer a familiar mouse versus a stranger mouse, and so on. So this is one type of experiments where we target social behavior, and similarly there are tests that were developed to examine repetitive behavior, restricted interest, learning and memory, and more of the associated symptoms. So both core symptoms of autism and associated are tested. So in our lab, we focus on a single gene, MTHFR, which is critical for utilization of folic acid in a metabolic pathway that actually produce a lot of substrate needed for development. And we can say that either if the mother or the offspring is deficient in this gene, the offspring show developmental delay and core symptoms. So what we call core symptoms are, we call it autistic-like behavior. A mouse is not autistic, but he presents autistic-like behavior. And with this model that we established, we managed to intervene with proper supplementation during pregnancy or at early development and reduce the percent of mice that actually show this autistic-like behavior. And in more recent work, we showed that even mice that already they were older and they already presented autistic-like behavior, by treating them at adulthood, we managed to reduce the symptoms. So now we're like in human, going into the very early age, early detection of symptoms in mice, which will predict later on development of autistic-like behavior, and also will serve us to identify biomarkers. So in this example, we can see that the different colors on the pie represent different types of calls. So wild type mouse is the normal mouse is more or less using the same amount of the different types of calls, while the deficient mouse already at postnatal day 6 is really very tiny, looks more like an embryo, produce just half of the calls with the wide repertoire and repeat a lot a single tone, which is very monotonous also. So this is one of the markers that we are looking for, which will be able to correlate with later on development of autism. And we can use it also for developing intervention and try it at this early stage and see if it's really attenuate the chance or reducing or maybe rescuing the mouse completely from developing autistic-like behavior. So this is just the tip of the iceberg of our work, but it's all actually done in order to adjust it later on for intervention in children that really show this type of biological direction. And speaking about children, Gal Meiri is the one and only that can really tell you about the children in our center.
Hello, good evening, Erev Tov, Shalom. It's a pleasure and honor to be here. So yes, that's me enjoying my work every day. And all this wonderful research collaboration is actually for those children that we see, we diagnose, we are with the parents and the families for years. And I will try to share with you some of my clinical input to this center and how I see this collaboration working so well for the children and the families. Next, please, Ilan. So when I see children and I see the parents after making the diagnosis, parents are asking me, how should I treat my child? And looking at the research all these years, and I'm working about 2 decades now with children and families, many times I'm embarrassed by what the literature and the research has to say, for example, about education system effectiveness. So one of the studies that we are trying to do now is really to see, are there any differences between the profile of the children that are going to special education or inclusion? There is a big debate what works best for the children. And since we have this opportunity also to see the children in follow-up visits after 1, 2, 3 years and more, we can also collect data about their progress and to see which treatment actually worked or education system worked better for them. So we are now in this effort. This is a very difficult and interesting study, and we are trying to figure out to see, to come with good results and good answers to the parents. Another interesting issue is how to ameliorate and how to help some of the really difficult symptoms like aggressiveness, self-injury behaviors, and there are many psychiatric medications with some side effects and not always very effective. And cannabis, medical cannabis, was started to use in Israel first to epilepsy, and then some of the children with epilepsy also have autism, and parents did see some advantages to the medical cannabis, and they started to use it like off-label and started to make a lot of pressure. And it started like something that is very kind of, I should give my child cannabis because it will treat his symptoms, or for some parents, it was even the hope that it will cure the child from his autism. So what we are trying to do is really trying to do research about medical cannabis in order to see if what is real, how does it really help, and with the other data that we collect, also to trying to see which child will benefit from which kind of strain of cannabis. Does it good to everybody or only to part of the children? Another difficult symptom in autism is sleep problems. So we are also now, one of the studies that we are starting now to see is how can we help parents better with behavioral interventions in sleep difficulties of autistic children. One of my interests is the Bedouin autistic children and the Bedouin community. The Bedouins are a large population in the Negev. About half of the laborers in Soroka of the Bedouin population, a very young population, and part of them lives in villages and cities and part in other places. And can you hear me? Sorry. Okay. And when we just opened the unit, we couldn't almost found any children. So we started to make a project in order to increase awareness and knowledge and diagnosis. I had a wonderful person helping me, Suleiman Abuhani. He is a nurse from the Bedouin community. Actually, the Ministry of Health started to dedicate him to this project. And this was even before our research center was established. So we were able to see that once we were reaching out the community with education and with raising awareness, we were starting to see how the caseload started to grow and how the age of referrals started to decrease, as Ilan mentioned before, the significance of diagnosing in a very young age. Next, please. So today, as I said, there is half labors of Bedouins in Soroka, and we see that from zero almost referral kids, we have much more. Still a quarter from the referrals of suspected children with autism are coming from the Bedouin community, meaning that we have a lot of work to do in order to see the other children that we can diagnose right now, and we need to understand the differences and to raise awareness. Continue to raise the awareness. Next, please.
So,
final word is for Ilan, please.
Thanks, Gal. I wanted to just, I hope that this combination of speakers, clearly demonstrated the necessity for multiple disciplines, and the fact that we're all working on the same children, that's really the core of the center. This has turned into a national effort. What you see here is the national conference that we had this year in February, 2 weeks before the COVID-19 outbreak. We were very lucky to get the conference happening. And if you'd like to learn more about us, I encourage you to visit our website and our Facebook page. And I think it's time to have some questions and answers. So thank you.
So thank you, Ilan, Idan, Hava, and Gal for your presentations. We have a lot of questions that have built during your presentation, so we're going to do our best with the last 15 minutes or so to get to some of those questions. Thank you, audience, for participating. Our audience numbers have held very strongly. We're around 200 right now, and we have 18 questions. We're not going to be able to get to all of them, but I'll start with the first, which is, with behavioral therapy or other therapies, can children actually outgrow autism, or is it a lifelong issue because it's a brain condition?
So that's a super interesting question that we're very interested in, and of course also Gal. And we already see kids in our longitudinal samples that are about somewhere around 5% of the children. Their ADA scores are so low that they no longer fulfill formal criteria for autism. That doesn't mean that they often, maybe Gal will expand on this in a minute, they often have other diagnoses, but there is a certain percentage of children who lose the diagnosis at some point in life.
Do you have a number on that percentage? I'd never heard that before.
So the number is around 5% as far as I know. Gal, maybe you'll add.
Yes, I would say that the optimistic part about working with the families and children on the spectrum is really to see the way they progress, and really the way you see the symptoms are much lower when they grow up, and you see the effectiveness of the treatments. So of course, every child is different, and the starting point is also significant, but you can see over time, the ADA score is kind of a number, but for me as a clinician, hearing from the parents, my child was first in a special education, and then he got better, and we put him with some assistance in regular education, and then he got even better, and we didn't have to put special assistance in the classroom for him. So after 2, 3, 4 years, I was able to say, okay, maybe there are some small symptoms, but he's not meeting the criteria for autism anymore because it's on so low intensity and with no help. So the improvement is really very impressive in many cases. Not all of the children are losing their diagnosis, but some, maybe 5 up to 10% are actually getting that better.
Thank you. We have a question about with some of these techniques, Ilan or others, how early can we actually confirm an autism diagnosis?
So the autism diagnosis is still carried out entirely by physicians in structured clinical systems, and all of the technology and these other approaches are in development. And the hope is that within several years, we're of course not the only group working on this around the world, the hope is that within 3 to 5 years, there will be measures, probably eye tracking will be the first measure that will be used to supplement the clinicians. Nothing will ever replace the clinicians, but there may be technologies that could help the clinicians and maybe identify risk early. Today, Gal and his team diagnose children as young as 12 months old in cases that are very obvious and severe, typically more commonly around 18 months and onwards. And the hopes is that that these technological aids will help reduce those ages.
Thank you. Idan, you were presenting on the impact of general anesthesia and C-section on autism risk factor. We have a question about ultrasound. Is there any linkage between ultrasounds and autism?
So there were a couple of papers that showed some effect or some association between the number of ultrasound scans and autism, but these results were very, there were some positive results, some negative results. They weren't very consistent. So taking all these findings together, I don't think these findings are not convincing enough in order to say that ultrasound scans are associated with autism risk at the moment.
Thank you. We're getting some questions about, I think in the COVID environment, about viral infections. Any knowledge of correlation between viruses and risk for autism?
So what I can say, okay, yeah, Gal, it's your, yeah.
I cannot say, I mean, we know from the literature about risk with pregnancy complications, which sometimes can be also viral infections, but usually it goes with the more severe cases like rubella and other really difficult viral disease or a bacterial disease during pregnancy. So usually when we say some risk, it's usually related to pregnancy or neonatal complications.
I want to add to this one. So we just completed a large study where we looked on different infection during pregnancy and the risk of autism. And all across the board, we didn't see any association between any kind of infection during pregnancy and autism. So this is further supporting what Gal said.
I will add one word because it was really hot topic, but in the context of schizophrenia in the past, and this is one thing that is very debated in terms of animal models, how much the animal models of viral infection indeed really replicate the findings from clinics in order to explain what's going on. So again, for autism, it's not very strong base yet.
We're getting some questions about the range of intelligence that is displayed from people with autism, some incredibly brilliant. Does your research dig into this topic at all?
So there's a huge range of IQ, of cognitive abilities that's very apparent in the children, from cognitive impairments and all the way up to brilliance. So Idan has a questionnaire that he's looking at about some special abilities. There's a lot of interest in the savant abilities and children who are able to fluently speak 2 languages at the age of 3 and can even spell words and things like that, and who are part of the spectrum. But there's very little research, and it's only at the beginning. I don't know if Idan, you want to add to anything to that?
Yeah, so about these special abilities, I'm highly interested in these exceptional abilities that are usually coming together with these autism, with children with autism. The problem is that most of the large studies are related on parental questionnaire, which are not very reliable, because parents tend to associate special skills to their children, even they don't really actually have this exceptional ability beyond their peers and so on. So we are now working on a questionnaire that trying to compare relating on parental questionnaire, but we ask the parents about the affected child and his siblings and the other members of the family. And what we see initially that there are not actually no differences in the way parents are marking or saying that the child has ability compared to his siblings. Sometimes even the siblings have better skills than the autistic child. We know that these special ability exists. We don't really know what is the percent, what is the prevalence in the population. We believe it's somewhere between around 10%. And the real difficulty is to really identify these children, and then we can study their other characteristic more deeply.
Thank you.
If I can just add a word, as a clinician, I see all the spectrum in autism severity and IQ. And I do see some of those really high IQ kids. It's really fascinating. Sometimes they really have special skill like the savant, but I also see a lot of developmental problems and intellectual disability. And even for some of the parents, it's really problematic when they see those kids with the really high abilities, and they say, at least for some of them, they don't represent my problems because my child has a very severe problem. So what people called in the past Asperger and the savant, they have like nice movies about them, like the Rain Man and all that, but it's not really the vast majority of the children.
Thank you. We're getting to the end of our session. One last question on vaccines. Are vaccines at all related to autism risk?
This would be my...
This is okay.
So this is actually emerges in the late 1990s, the end of the 20th century, by a physician that actually examined 11 or 12 different children and suggested that vaccine caused to their regression and then autism. But it was shown that he fabricated most of his results, and later on various huge studies and national studies, both in the US, Scandinavia, I think also in Israel, show that there is no association with any kind of vaccination with autism risk. We actually now looking on young children, on data from young children before they have been diagnosed with autism. We are trying also to look on this question. The problem here is that more than 95% of the children in Israel are getting vaccinations. So it's very hard to see if they are different from the other 5%, because the other 5% are it is a very small sample. But overall, the data shows that there is no association between any kind of vaccination and autism.
Thank you very much. So I want to compliment and thank all of our participants. You've set a record, by the way, not only for high attendance, but for the most questions we've ever had on a webinar. We have 41 questions. We weren't able to get to all of them. People asked questions and we weren't able to answer them. We are going to make an attempt to provide written answers, and we'll communicate with you via email. Ilan, you want to explain again where people can find out more information about your work at the center?
Yeah, so I encourage you to come visit our website. URL is autismisrael.org. You can see it here. We also have a Facebook. You can join there. We have mailing lists, and we'll be very happy to answer any questions that folks have sent in a written format. That'd be great.
Okay, great. So autismisrael.org. And also, we've gotten a few questions. While the questions keep building, Ilan, if you can stop the screen share.
Yeah.
But the questions keep building right toward the end. It's amazing. So it's a very important topic to people. We've also gotten questions about will there be a recording available? And the answer to that is yes. So watch the Friends of Soroka and also the AABGU Facebook pages and our websites and on LinkedIn. Also, if you'd like, friend me on Facebook or connect with me on LinkedIn. You can find all of those on my personal pages as well. So Rachel, some closing remarks.
Thank you, Doug. Well, this was an extraordinary program, and I would like to congratulate and thank today's participants. We're extremely proud of you, of Soroka's role in establishing Israel's National Autism Center, and in our collaborative work with BGU to bring new research, new resources, and opportunities to autism patients and their families. At the outset of the pandemic, American Friends of Soroka Medical Center launched an Ask the Expert series featuring expert medical professionals in our effort to share with you medical news that you can use that will help you stay informed while getting your questions answered on up-to-the-moment inquiries and concerns. Participants learn together how to craft a personal strategy to stay safe and healthy, to optimize our health, to deal with disease and with the COVID-19 threats. All of our past sessions have been recorded and are available for you to view on our website, soroka.org. Our next Ask the Expert session is on Thursday, July 23rd at noon EST, discussing how to get ready for the upcoming fall and winter season while staying healthy, informed, and resilient. Look for the invite in your inbox. And for more information about our Ask the Expert series, please email Pazit Levitan. That's PAZIT @soroka.org. Finally, I invite you to save the date for our Sunday Desert Chic Brunch Virtual Gala. It will be October 18th, and we will celebrate together our commitment to Soroka and to the promise of the Negev. So I invite all of you to join us, join the Soroka family. We'd love to welcome you. Please feel free to contact me, Rachel@soroka.org, for a friendly conversation and to keep in touch. Wishing you all the best, and shalom.
Desert Chic Virtual Gala. That sounds like a lot of fun. I think I'm going to have to attend.
You don't want to miss it.
All right, thank you very much. So just as we're wrapping up, I want to once again thank our panelists, Professor Ilan Dinstein, Dr. Idan Menashe, Professor Hava Golan, and Dr. Gal Maeri for your participation in this webinar and your incredible work. For those who just haven't gotten enough, and by the way, the questions keep building. So again, we will email them to the participants. If you've asked questions anonymously, then we don't know who's asking. It's hard for us to email directly with you, but we'll make an effort to email to the participants questions that weren't answered. David Ben-Gurion, who's the founder and first prime minister of the state of Israel, and the guy whose name is on the door of our university, once said, "We seek to build a scientific research and teaching center which will be a source of moral inspiration and courage, rousing people to a sense of mission, noble or creative and fruitful." I think that the four of you are great examples of experts at Israel, both at Ben-Gurion University and at Soroka Medical Center, that represent everything that Israel's trying to be and is, a true light unto the nations and a positive value-added contributor to the world. So thank you for just everything that you do. For those who want to tune in next, our next hashtag webinar Wednesday will feature Bedouin life at Ben-Gurion University on July 22nd. For those of you who are unfamiliar, the university by far in Israel with the most Bedouin students is Ben-Gurion University of the Negev. We have about 600 Bedouin students. The vast majority of them are women. And if you want to learn more about our programs and get involved in how to change the trajectory of the life of that part of Israeli society, please join us on July 22nd. I want to close with just thanking again Rachel for the collaboration with Soroka, and also our top marketing and events team led by Ronnie Strongen and her team, as well as Melody Mokhtarian, our director of events and experiences. She's become quite the expert at virtual events and webinars, as well as Dana Ben-Benyamin, who does our work in Israel to liaison with all the different scientists, et cetera. So thank you so much for joining us. Have a good day and stay safe.